Hello, Favor. How are you doing?
Okay, how are you too?
I'm fine as well. I'm fine as well. I'm trying
Okay.
to send the link. I will need to get. Hello, Naima. Welcome. Thank you for joining. We're just waiting for a few more people to join. Thank you for joining.
Um,
We'll get started soon. Yeah,
should
what's that?
I should I drop the link? The link you sent to me yesterday. Should I just drop that one in the group? On my status rather.
No, I will send you the link for the live video. There's an actual link for the live video. I'm trying to get it from my other phone. So I'll send you that one.
Okay.
Yeah, so they'll be able to join the live session so that they
And
don't
some of my
just go to the
friends
page.
to join.
I'll send you a link.
So I think I'll just talk for like let's say like 15, 20 minutes. Then I'll give room for questions and all.
Okay, 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 that's fine. Um, hold on. Yeah, I've sent you a video now. Let me see if it's a link to the live video.
Okay, I've seen it. So let me just go there now and run.
Okay, so let me also share it with people who would be coming. Hold on. Let me just share to my people. Yeah, you have seen the link I sent you, right? So just hold on to say around like 7:05 where a number of people would have joined in and then we'll move. I'm just trying to share it in my social media pages so that more people can join.
So we're waiting for people to join. Is my face clear enough?
Is that
Is
what?
my face clear enough?
Yes, yes, yes. It seems the people that were here have even left the live, but
Three
okay, I
people have
think they're
to
back now. Okay. I see a number of people joining. Welcome to those who have joined. We'll start in earnest. We're just waiting for a few more people to join us before we get started. I'm just trying to share the link with a few people so that a lot more people can join. Um, where was I? Okay, we're six. Once we reach, say, about 10, I think we'll be able to get started.
Okay.
Anyone that comes first, either 7:05 or we reach 10, either of the two. 7:05 comes first, then we'll join. Okay. Welcome to everybody joining. Thank you for joining. I hope you had a great day. Mm. Hello. Hello, Toluwanimi. Welcome to the live video. Thank you for joining in. I hope you had a great day. Okay. Oh, okay. Hi, I didn't see who that was. Hi, Buki. Welcome. Thank you for joining in. I hope you had a great day. Yeah, so if you're new to this channel and you haven't subscribed, please you can subscribe now before we start. We'll start in the next 3 minutes. So if if you are new to this channel and you haven't subscribed, please subscribe now. So if you see me looking away, I'm just trying to forward the link to some other people. Yeah. What's the time? Okay, we start in 2 minutes. Counting down. I just wanted to be, some sort of people here before we actually get started. Where was I? Welcome to those joining in. Thank you for joining. Hello, Pamela. How are you doing? Thank you for joining. We have an interesting evening ahead of us, and we have something really interesting waiting at the end. Nobody probably expects this, but we'll surprise everybody today. Yeah. Okay, 1 more minute to go. You said?
No, I just checked the time.
Yeah, 1 more minute to go or less than because it's like 7:04. Okay, it's 7:05. So I think that we can start now. So good evening to everyone and welcome. Thank you for joining the live video. It's September, and September is usually uterine cancer awareness. And that's why we're hosting this live video. Hello, Dominic. Welcome. Thank you for joining in. September is usually womb cancer awareness. We also call it uterine cancer awareness. And that's exactly why we are hosting this video to let people know more about it. Because, they usually say prevention is better than cure. So you can know, okay, I have this symptom. I should go and treat it soon and all of that instead of getting to a point where it is irreversible. We are seeing situations where, let me just digress a little bit. I have seen situations where, let me use breast cancer. That's a topic for next month, but let's just, where someone found out that she had, I think it was stage 1 or stage 2 of breast cancer, and immediately they were able to do a surgery to eliminate the cancer. So imagine she didn't find out, that early. There are also scenarios where, hello, Lucky Joseph, thank you for joining in. Hello, Shay Taiwo, thank you for joining in. There are also situations where you see people don't get to, find out about the ailment until it has progressed to, say, like stage 3 or stage 4. Stage 3 or stage 4 is like the semi-final slash final stage where it's no longer treatable. So if it gets treated, it's by some, by some form of miracle, right? So that's why we are hosting this live video, and we'll be hosting a number of other live videos to talk about this kind of things so that people can stay healthy, and get to know more about this particular topic. So today we'll be handling uterine cancer, and we have a guest here with us. I have a biography about her, which I'm going to mention shortly. She's going to be taking us on what we need to know about uterine cancer. And after the session, we can all ask our questions if we have questions. We can also drop the questions in the chat if you have questions. And then if you want to send a private question, you can send it to WhatsApp for those that have my contacts. Yeah, for those that have my contacts, you can send it to WhatsApp, or you can drop it in the chat, and we'll be able to answer your questions by the end of this session. That is, if it has not already been answered. Hello, Olajumoke, welcome. Hello, Niger Abroad, welcome. Yes, so we'll just move into what we have for today. So our guest here, I'm sure you can already see her. Her name is Akintola Favor Ayomide. Right, she's a registered nurse. She hails from Kwara State, and she grew up right there as well in Ilorin. She has about 2 years working experience. She has worked in places like Misalu Hospital, Mami Eye Clinic, and basically she's going to be the one taking us on our topic for today. So I would like you all to just sit back, relax with your pens and your books, and yes, let's get started. So over to you, Favor, please.
Okay, thank you very much. Hello, everybody. Good evening.
Thank you.
Um, I am Favor Yomide Akitola, and I'm a registered nurse, as she has rightly said. So, straight to the point, are we talking about uterine cancer? But when you hear about the uterus, for a layman, they'll be like, what is the uterus? So, let me break it down. The uterus is the womb, as we all know. So, this womb is the one that houses a baby. But if there is no baby, it sheds its lining every month, which results into menstruation in females. The womb is only in females, males do not have. So when we talk about cancer, cancer is all this an abnormal cell that grows in a particular organ. Just like these cells start to infiltrate, they start to destroy the original cells of a particular organ. So the one we are going to be talking about is the uterus. So uterine cancer is the cancer of the uterus, of the womb. That is abnormal cells. They destroy the cells of the uterus. So the uterus has a lining called the endometrium. The endometrium is that lining that we shed every month that we call menstruation. So in the absence of pregnancy, the endometrial lining will be shed. So when we move further, the classifications of this cancer, most of the time it is classified into two: the endometrial cancer and another part of the uterus. But 95% of the cancer actually affects the endometrial lining, whereby it's going to start gradually till it eats up all the healthy cells in the uterus. So you ask me, how will I know if there is cancer or not? There are several ways by which the person gets a hint that okay, something is going on. That is, for example, if they are having heavy bleeding in between periods. It's not time for period yet, but the bleeding is just coming. That should sound a note of warning that something is wrong. Also, if uh, the person is just having difficulty in urination and discomfort in the pelvic region. The pelvic region is the pelvic region. If there are lots of discomfort there, that is one of the symptoms. Although it varies in people, there are people that don't know that something is wrong with them till the cancer has advanced. So in people, there are some people that risk of having this cancer, or that like for people that are above menopausal age, that have reached menopause, like 50 and above, they are at higher risk of having cancer. Also, according to some of the materials I was able to get, I noticed that in black women, the chances of getting an uterine cancer is higher than a woman of another race. So that means black women have higher chances of having uterine cancer than other races. Also, for someone who has it in their family history, for example, maybe the sister had it, the aunt had it, the mom, there is like a 60% chance that the person might likely have it as well. So that is in family history, the person might also have the family history can also predispose the person to having uterine cancer. So um furthermore, when talking about some of the symptoms that the person can see, we can also say if the person feels some a kind of swelling in the tongue and the person is not pregnant and the swelling is just there, all those things are abnormal signs that one has to look out for. Also, unexplained weight loss because cancer has a way of eating up healthy cells and it makes the particular person that is involved to become slimmer and you will start wondering, is everything okay? Although weight loss is usually seen in advanced stages too, but unexplained weight loss too can be one of the causes. And in Africa, it is noticed that we don't really go for our checkups like that. Even though many people feel that they'll be like, I'll be okay, I'll be all right. Ignorance can also be one of the reasons why many people don't know that they have endometrial cancer, which can be very deadly. So moving on, we are going to be talking about stages. Stages are into four stages, like stage one, stage two, stage three, and stage four. For stage one, the abnormal cells are only confined into the uterus. They are only affecting the cells of the uterus. They have not gone far. Then moving on to stage two, the cells would have eaten from the womb down a bit before the vagina would have gotten there. That one can be dangerous as well. It is dangerous, but with appropriate help, it, it can be controlled. But moving on to stage three is when it has moved to the ovaries, to the uterus, to the cervix, and even to the vagina. Then there are there are ways that can be managed, but not can be managed. Then stage four is the final stage where it has moved from the uterus, from the vagina to other parts or to other connecting organs like the bladder, the rectum, and that one is very, very dead. So maybe because of the inaccessibility of healthcare system like that in Africa, we don't really do a lot of checkups with our gynecologist because normally we are supposed to do ultrasound scans just regularly, even without any abnormality. Checking yourself regularly is going to help to prevent any form of will help to get an idea, okay, this is what is happening to me, this is what is not happening. And if they notice any form of abnormality, they'll be able to work on it on time. So it was estimated that about 3,300 women were diagnosed in the first half of this year. That was in Australia. Statistics is in Australia. About 3,300 women were diagnosed of. uterine cancer. That means it is one of the most popular, apart from after breast cancer, it is also one of the, like, I think the third most common cancers that affect women. So moving on, we are going to be talking about. I hope we are getting it. I hope I'm not being too fast. Okay. So some of the things that can be used to prevent, like ways by which you can prevent uterine cancer, uh, by using birth control pills. Although it is not, there is no known prevention. All these ones are just to help to reduce the risk of having uterine cancer. So it was said that using birth control pills can help to regulate the hormones, that is the estrogen and the progesterone in females. Also, regular checkup, just regular checkup will help to note if there is any form of abnormality. But the biggest type of prevention or early detection is if you notice any form of abnormality and you decide to go to the hospital on time, not just I'll be okay, I'll be fine. A nonchalant attitude also contributes to the way by which this cancer just goes, because since nothing is done about it, if you don't check on time, it just continues to go, and cancer can be so aggressive that it will just continue to go and go and go. And early detection can help to really control it and even remove it completely, and it's going to die off. So, the preventions that we talked about now is that check for any form of abnormal signs in the body, like unusual heavy bleeding, uh, kind of unexplained pain, swelling in the tummy, and like painful urination and all. Those ones are kind of pointers to be able to help you know that okay, this is what is wrong. Let me go to the hospital on time. And all. So there are known treatments for uterine cancer, but the success rate is high to an extent because I've managed some cancer patients and some went home while some did not make it. Some of the known preventions that I have seen over time, one is surgery. Surgery works for those that their cancer has not advanced, like maybe in stage one or stage two, or maybe early stage three. They can still say, okay, let us remove the entire organs and save the rest so that it will not spread. Some, they will decide to, if surgery can no longer work, they decide to go for chemotherapy, and we just continue to care for them if they get better or if they don't. But the best treatment so far is prevention. Once you notice something is wrong, go to the hospital immediately. Don't wait and say, okay, let us look at it. Don't look at it, because it's one thing about cancer is that it can be so aggressive. If it is a malignant one, it can be so aggressive that it just continue to rush and rush and rush and till it kills the person. So I don't know if I was too fast. So I we've been talking about uterine cancer. I said uterine cancer is the cancer that affects the womb, and the womb is the organ that houses a baby. And in the absence of a baby, the females we share our endometrial lining. There's this lining in the uterus. We shed it every month, and that's what we call menstruation. So this cancer, we said, they are abnormal cells that eat deep into healthy organs. They displace the healthy organ, they displace the healthy cells in an organ, and they just continue to grow and destroy the organ completely. So we said uterine cancer is the cancer that infiltrates and destroys the uterus, which is the womb. So we talked about the causes. We said if it is in the family history, that is maybe the aunt had it, the mom had it, or maybe grandma, there is higher chances of the offspring having it as well. We also said that for females that are above the menopausal age, like 50 and above, that reach menopause, because the reason why they are higher risk of having this uterine cancer is because the estrogen that is produced, the hormones that are produced in and actively someone that is younger, that is still in their reproductive age, the hormones that are produced in someone like 20, 30, 40 has reduced in someone that has reached menopause. So that predisposes them to having uterine cancer. I'm not saying all women above the age of 50 would have cancer, but because of the decrease in the hormonal production, hormones production, it really predisposes them to having cancer. Also, although younger women to have it, but the chances are lower. Also, he said for okay, overweight people too, like obese people, they are the risk of having this endometrial cancer. So I also said that endometrial cancer, they are uterine cancer is divided into two. The most common one is the one that affects the endometrial lining, that is the lining of the uterus, while the other one is the one that affects just the muscles, like it affects the muscles, but the most common type of uterine cancer is the one that affects the endometrial lining. Then dividing it, uterine cancer is divided into four. The first stage is the one that affects only the uterus, and it's just there gradually, gradually. Over time, if it's done, it moves to stage two, and stage two is where it affects the uterus and the cervix. The cervix is just like out in between the vagina and the uterus. The cervix, it affects the cervix. Then, if nothing is done again, it continues to move till it affects the ovaries, the lymph nodes around it, the vagina. Then, if finally nothing is done, back down to stage four is when it moves from the reproductive system, female reproductive system, and moves to connecting organs like the rectum, the bladder, the other places. Because let me give an example. I nursed a patient one time, and then the patient had cancer of the lungs. But before they could do anything, the woman had difficulty in breathing, so she felt maybe she was asthmatic or something. Nothing was done on time. But by the time they did X-rays over and over, they discovered that she had cancer of the lungs. But by the time they discovered, it was late. So we just had to take care of her, like we just had to take care of her just like that till she could no longer breathe again, and the whole thing spread to her abdomen, her intestines, and it eventually killed her. So early detection is one best way to prevent any form of cancer. That's the best way. Once you notice that okay, something is wrong, maybe your period came on the 20th of this month and you're supposed to expect it on 26th of next month, and maybe on the first of the following month, and you're experiencing bleeding again, and it's not time for your period yet, then you should know something is wrong. So instead of keeping it and saying, okay, I'll be fine, the bleeding will stop, go and see a gynecologist. Because one of the major things that gives this cancer an upper edge is when we do nothing about it and we just try to just let it, okay, I'll be okay, I'll be fine. Nonchalant attitude affect it a lot. So one of the major preventions I've said earlier is early detection. Once you notice any form of abnormal signs in you decide to say, okay, let me go to the hospital. Don't let me keep it to myself. Because early detection equals to early treatment, and then even ruling it out completely. So, talking about the prevention, taking according to some of the articles and some of the research that has been done, it was noted that taking birth control pills can also help reduce the risk. Although there is no known prevention, but reducing the risk by taking birth control pills for some people, that is, the birth control pills helps to balance hormones. Also, uh, um those are the ones that, and keeping a healthy weight for those that are overweight. Those are the major two ways by which it can be prevented. It can, like, the risk can be reduced. Prevention, there's no known way, but it can reduce the risk. So, for the treatments that I have seen, surgery is one. If that is if the cancer has not really gone that far. For example, for some people, they remove their uterus completely to prevent the spread of the cancer from the uterus to other parts of the body. So if the cancer is still confined in their uterus, they just decide to remove the uterus completely, and they continue to treat them and make sure that the cancer has not spread to other parts. And for those that the cancer has spread to other parts, just treat them, just care for them holistically, at least care for them till they recover or they die. And also chemotherapy also help some people out. There are success rate of people use chemotherapy and they were okay with they got healed. But the best way is, if you notice any form of abnormality, go and see your doctor immediately. Don't wait. So I hope I did not rush. I hope that with these few points of mine, I've been convinced and not confused that prevention is better than cure. Thank you.
Thank you very much, Nasvivo. You did a very great job on this topic. So I'm just going to give a summary. Let me just call it a summary of um of what you have said so far. I was jotting down a few points. So yeah, I'm just going to give a summary. And if anybody has questions, you can drop your questions in the chat box. Yeah, you can drop your questions in the chat box, or you can signify and we'll let you talk, right? Yeah. You can signify and we'll let you talk. If you have questions, please you can drop them in chat box, or you can send a message on WhatsApp. I almost said Instagram. You can send a message on WhatsApp. Um yeah. So let me just give a little summary of what she said. I'm actually going to my summary book. Yeah, so from from factors that could contribute to womb cancer would be obesity. If a person is too big, let me say on the big side, obese, overweight, it could contribute to uterine cancer because of the fat tissues that are surrounding, the organs and all of that. Then genetics, that's something that is hereditary. So that's why sometimes some people may say, oh, they have some certain symptoms, and when they go to the doctor, part of what the doctor is asking you is, oh, have you had any close relative or close family member that's ever had any type of cancer at all? They are not even specific. They are just like any type of cancer, because they know that, okay, there's a possibility of you, developing, that type of cancer. You see some people that their mom had cancer, and then all three daughters also had, a similar type of cancer, and they all had to treat it and deal with it that way. So yeah, we also had we also talked about the stages of cancer, which is stage 1 to 4, with 1 being the lowest and less risky, and 4 being the highest and the most risky, and with a reduced choice of survival. Yeah. And it was also said that, let's say an African now, a black woman is more likely to contact uterine cancer, also known as endometrial cancer, than a white woman, let me say white woman, is to do. And then for the treatment, it was basically based on mainly surgery, yeah, and then chemotherapy basically. So if you have questions, you can now ask now before we round up. Yeah, just checking to see if there are any questions. Are there any questions? I am checking the chat box. Uh, yeah. thanks to everybody that came. We have before we leave, we actually have something interesting for people that came. Yeah, greetings to everybody. Naima, Toluanime, Bukola and Buki, Pamela, Dominic. Thank you all for coming. Shay Taiwo, Lucky Joseph, Niger Abroad, Angela, Okoje, how Olajumoke. Let me just say Olajumoke. I'm just reading what I know. And everybody else that came. Scholar K. Okay, that was the scholar. And everybody else that came. Chizoma, everyone else. Thank you so much for coming. So before we go, we have a little, let me say a little exercise. Oh, hello, Olalaji. Thank you so much for joining. Yeah, we have a little exercise. Yeah, so this what do you call it? Cancer awareness series is basically still on for the rest of the month. Basically, it's on for the rest of the month. This is just like the first, let's say the first episode. Yeah, but this is mainly for womb cancer awareness. September has both womb cancer and ovarian cancer. So just a little background of why we're here. We have hello Ibukun. We have, let's say, so in Jiro's cancer awareness, we treat cervical cancer, womb cancer, ovarian cancer, and breast cancer. So this month is for ovarian cancer and womb cancer. So that's why I said this is the first episode. So from next week, you would see another episode like this, a live video like this for ovarian cancer, and I can show you that it's going to be an enlightening session as this. And then we thank our host for coming. She did a very good breakdown. Yeah, so you can just thank her in the comment section as well, even if you don't have questions. So yeah, before we go, so I would like to encourage everyone to be joining this session. We have not even spent up to 45 minutes here. Before we go, I have something for everybody. So we have free recharge cards. Yeah, so it's only people that are in this session that will get it. So you can get your pens ready. Is it pen now? Your phone ready? You have to recharge card. I'm trying to find. Are we ready? If we're ready, please let me see your comments in the comment section because I'm about to call out a certain recharge card. I have it here with me. Thank you, Olalade, for joining. So please, I must see your comments in the comment section before I call it out. So I have different networks here. There is Airtel, Glow, MTN. Okay, Sims is ring. MTN, and I'm trying to remember Nine Mobile, and yeah, just those four. So if anybody's interested in the what's this? Okay, if anybody's interested in airtime, please just say hi in the comment section. And I'll drop it ASAP. I'll just call it out. Okay, so we have someone that is ready here. Um, so I'm going to start with Airtel. Yeah, I am going to start with Airtel. And please, when you get it, please comment in the comment section. Please comment so that we don't keep calling it. So for Airtel, you can get your phones ready. You will have to remember the code, sorry. You know the code now has changed. It used to be star 126 star. Now it's totally something else. So Airtel, get ready. Airtel, get ready. Airtel, get ready. So for Airtel, we have 5484703529973424. I don't know if anybody has gotten that. I'm actually trying to read it very fast. Okay, I think I'll drop it in the chat box. Just let me know if you have gotten it. So this is just like basically to thank everybody for coming, basically, right? And to encourage you to come for the next one, right? Yeah, so you can just let me know if you have gotten it. Thank you very much. Has anybody gotten it? Airtel, Airtel, Airtel. Nobody is using Airtel here. You are using something else.
I think they are using most of MTN.
MTN. Okay. Let's go to Etisalat then. Etisalat, we have yes, so if anybody has gotten it, please let me know. Please comment there that you have gotten it. So Etisalat, that's Nine Mobile, in case you are wondering what I'm talking about. We have Etisalat, we have 3570397548. So you can let me know if you got that as well. I'll put it on the chat as well. I mean, the people that got it have gone off. Ne? Okay, I've dropped that in the chat as well. So if you're interested in either Etisalat or Etel, you can just pick any of the ones there. And it will expire as soon as I close this chat. To close the chat in the next 5 minutes. Hello, Mr. Yemi. Welcome. Hello, Emeka. Hello, Ibukun. Welcome to everybody. So if you are just joining us, we are distributing free airtime. Yes, there was a part of the Bible that said that after Jesus taught, he taught the crowd, and then he said we need to feed them. We don't just send them away. So that's what we are doing here today. It's not like we are feeding you physically, but at least we're sorting out something for you. So if you have gotten any of the two that we have dropped, you can just let me know
Okay,
as
Roma
well.
got the Nine Mobile.
Oh, hi, Chizoma. Congratulations. She got the Nine Mobile. That's good. You see, that's one of the good things of joining it. If she didn't join, I should go take get some. Okay, let's move on to the next one. We have Glow. We have Glow. Glow 40. Thank you for joining, Chizoma. Yeah. We have 40 for this is for Glow users 4037462986321. 4037462986321. Has anybody gotten the first Airtel that I dropped? Because apparently there are two Airtels here. Has anybody gotten the first Airtel I dropped? I'm dropping Glow now in the chat. So if you're available, you pick it before anybody else does. It's basically just our own way of saying thank you for coming. Yeah. 86321. Okay, so that's Glow. We have two more to go and we'll close. So we should be out of here by say 7:45. And after we're out of here, all these things would have expired, right? So if you want to load it, you can load this now. Oh wow, wow. Mr. Shay, you don't even used to chill at all. Oh, wow. So one person took Airtel and Glow. Interesting. Please, if you have taken before, you are not allowed to take again. Thank you very much. You now want to. Wow. Wow. Okay. I'm going to MTN. Please, if you have won before, Mr. Shea and Madam Chizomo, you are allowed, you have to allow others to win as well. Even if you have this MTN, please allow others to win. Thank you very much. And he was just being silent about it. Interesting. So we have MTN 9579 7526 9365 06631. I'm actually trying to get this in my head. Yeah. Well, okay, yes. So I'll go again for the MTN. We have 9579 7526 9365 06631 MTN. Ooh, let me see. Hold on, please. Okay. MTN. Please, if you are warned before, allow other people to win. Thank you very much and God bless. Um
Wow.
Oh, you won it? You won the MTN. Wow, that's interesting. That's interesting. Oh, you got it. Well, even before I put it. And then we have the final one. We have the final one. We have a second Airtel. Yeah, a second Airtel. We don't have a second of the others. So if you missed the first Airtel, you have a chance of getting the second Airtel. Airtel? Yes, this is Airtel now. I cannot be wrong. I should have given you people small work to do to guess the airline, but did I just say airline? Sorry. The network provider. But we'll just do this. So let's go for the last one. Uh 5864 2932 9625 8883. Hello, Barbara's Reality. Thank you for joining in. Thank you. Thank you for joining in. Let's go again for the Airtel 5864 2932 9625 8883. So that triple eight is 8883, something like that. I'll go for the last time. 5864 2932 9625 8883. Please, if you have won before, allow other people to win. Thank you very much. Ah, you got it as well. You got the Bookie, you got the Airtel as well. Where is our host? Our host. Okay. Yeah, we're seeing just your wall. Ah, congratulations to everybody that won. It was a really interesting time here. Mm-hmm. And then we thank our host, Miss Favor Akintola, for joining us here. Nurse Akintola, like she likes to be called. Right. We hope to have more collaborations in future, and then we hope to have more of this kind of educative live sessions um soon enough. That soon enough is like next week. So if you see me again next week pushing you all, just go out there for me. I'm requesting now. I'm requesting nicely because somehow some people will see me in your DM next week. Yeah, because it's still less for ovarian cancer awareness, and then you see me again in October, and then after that I'll let everybody breathe. Wow! So congratulations to the winners of the airtime. Yeah, we would always have something like a motivating factor, right? God bless everybody that joined this call, that joined this meeting. We hope it was insightful. However, if you don't want to ask your questions here, you can ask them in my DM, and I'll pass it across to the hosts and give you a feedback, so that we can talk about it. If you even want to talk to her directly, that's fine. I can link you up together and then you talk about it. Yeah. So we're actually in for a lot of good things, a lot of good tidings this is it this week, this month. Yeah, it's been it's been a very eventful one. It's almost 8 o'clock, it's almost 7:45. Yeah, it's been a very eventful one, and I want to thank everyone for joining. There's going to be a replay, so those that missed it will still be able to view the replay. Yeah, those that missed it will be able to view the replay and just watch everything. Yeah, be able to view the replay and watch everything. That was the last thing here. Okay, I did not write that. So thank you all for joining, and we'll see you next week. I'm not sure of the exact days next week, but I'll communicate to everybody and make sure you show up today like you did then. Can tell everybody about this video, blah blah blah, and we'll have a nice time. Thank you so much for joining. We hope to see you next week. Thank you to our host once again, Favor. Um, we'll see in the other room. like our former president used to call it.
All right.
We'll see in the we'll see in the other room, right? Hi, Nika. Thank you for joining us. So we'll see in the other room, somewhere in your DM. All right. So I'll leave everyone now to go back to their business for today. I didn't intend to spend too much of anyone's time, and I appreciate everyone coming out here. If you missed a major part of it, then the link will be available. The link to the replay will be available, and you'll be able to watch it and enjoy yourself. And if people are interested, we could do more live videos about other live activities, right? Apart from educational content, we could do others. So I wish everyone the best. I think it's finally time to end this live video. Right. I didn't really want to leave so early, but well, we have to respect people's time. Yeah. Thank you all for joining. And bye. Have a great night's rest. Bye. Okay, yeah. So those that joined, I hope you enjoyed this session. I actually do hope you enjoyed this session. I hope it was insightful. You want to see more things like this, you can just drop it in the comment section so I just know what to expect and feedback as well. You can drop it in the comment section. For anyone that is left. That way you can also just stay here and we just I don't know exactly what we'll be gisting about, but we'll be gisting. Uh, thank you for joining. Bye, Chizoma. Thank you, Titilayo. I'm just reading the comments I have here. So thank you, Mrs. Karin. Yeah, to everyone that has joined. I'm just joining. Thank you. God bless you. Um, if you are just joining, welcome, welcome. If you're here before, we have kind of finished, and I think you actually missed a lot. So, okay, yes. So, for those still online, you could please give me a feedback of how it went. Most of you are on my WhatsApp, so you can please send me a message there. If someone invited you as well, you can just thank the person for inviting you. Yeah, we'll be having a lot more of these kind of things as from next week, October, and all of that. Yeah, so thank you for joining. Okay. So I'll end this. We spent like 56 minutes. So if anybody else has anything to say, you can just say it. I'll end this video exactly in less than 4 minutes. When it's exactly 1 hour, I would end the video. Yeah. So things can change. Let's see. Let me see the go. Go. Let me. Okay, thank you everyone for joining. I said I was going to end this video by exactly 1 hour, so that's what I'm going to do. Let me just see that it has been okay. Let me just say that it was saved. I'll see you guys later. Bye. It's been past 1 hour now. It's been a great time chatting with everyone. I'll see you next week doing the ovarian cancer awareness. Bye.